My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. I'd like to thank Martha's Vineyard and ACP for partnering with AdMeTech Foundation since 2017 to present this annual prostate cancer awareness event. Also, I'd like to express my gratitude to members of the Martha's Vineyard delegation to the State House who made our programs, including today's event, possible. In my talk, I'll describe AdMeTech Foundation's history and our prostate cancer program, established to lead cutting-edge advances in patient care and eliminate health disparities. In particular, the focus of my talk is on the AdMeTech Foundation Prostate Cancer Equity Resource Project, created to ensure that all Massachusetts men have access to high-quality care, including the best-in-class advances in screening, diagnosis, and treatment available today. History of AdMeTech Foundation and its programs is closely tied with my own professional and personal history. Since 1990, I was head of Diagnostic Imaging Research Branch at the National Cancer Institute. In this position, I was leading development of national and international research policy and related strategy and programs for the National Institutes of Health, Department of Health and Human Services, and U.S. federal government. Our priority focus was on the advancement of breast cancer imaging. We created digital mammography, breast MRI, advanced ultrasound, and molecular imaging for improved patient care. We also worked on teleradiology for image transmission for a second opinion, so that we could bring world-class expertise to underserved, rural, and remote communities. These breast cancer programs led to transforming screening, early detection, and treatment of breast cancer and reducing health disparities. Precision imaging made it possible to improve screening and accurate diagnosis, critical for early detection and saving lives for all women. To create minimally invasive lumpectomy, when we identify and remove only a part of the breast tissue containing tumor. This minimally invasive lumpectomy replaced radical surgery such as mastectomy, when the entire breast and surrounding tissues are removed. Lumpectomy is performed in outpatient clinics with minimal complications, pain, suffering, and costs. Precision imaging and early detection also made it possible to reduce health disparities in Black women. In 1996, while our breast cancer programs were well underway at NIH, I brought together the key leaders of government, medicine, and industry who recommended prostate cancer as the next national priority focus for several reasons. First, prostate cancer is the most common major internal cancer among men. It is as common among men as breast cancer in women. Prostate cancer strikes 1 in 8 men, while breast cancer strikes 1 in 8 women. And yet, prostate cancer diagnostics and care lagged behind breast cancer by several decades. Second, prostate cancer screening with blood test PSA was successful in identifying men at risk of losing their lives and in reducing mortality or death from prostate cancer. However, men needed accurate diagnostic tools that would make it possible to sort out if abnormal screening result was due to false alarm or due to a life-threatening prostate cancer. Accurate diagnostic tools would make it possible to create personalized and most effective plan for clinical care for each man and avoid unnecessary procedures. Third, treatment of prostate cancer, such as radical surgery, was highly invasive and traumatic, leading to prolonged hospitalization, difficult recovery, and the unacceptable level of life-altering complications. Similarly to women with breast cancer, accurate imaging would make it possible to develop minimally invasive treatment for men with prostate cancer or male lumpectomy. Fourth, prostate cancer is a leading health disparity. Black men are 2.5 times more likely to die compared to white men. We did not see this level of disparities in breast cancer even early in my career, in the 80s and 90s. Finally, in sharp contrast to women with breast cancer, men did not have accurate imaging, leading to blind biopsies and treatment. Our work in breast cancer imaging created a blueprint for transforming prostate cancer care. At about the same time in 1996, I had a personal experience that left me rather shocked. A leading clinical expert in Massachusetts, chosen by me, examined my father and determined that he had a benign and common prostate condition. However, when my dad had an invasive procedure, he was found to have prostate cancer. It was stunning to me that a leading expert in a world-leading hospital did not have the appropriate tools to make accurate clinical diagnosis. This experience transformed my professional interest in prostate cancer into a personal mission to improve early detection and treatment of prostate cancer for all men and to reduce health disparities in Black men. If we made the difference for women with breast cancer, we could make a difference for men with prostate cancer. I mobilized other leaders of medicine, and we approached National Cancer Institute and NIH in the hope to see an increased government investment in prostate cancer research. Unfortunately, in spite of our joint track records and a year-long effort, we did not succeed in convincing U.S. government. In response to the lack of support from federal government, by late 1997, we established AdMeTech Foundation with the mission to end blind patient care and create the future of image-guided, minimally invasive diagnosis and treatment. We call it the Manogram project. Since 1997, we have been leading pioneering research that resulted in creating and clinical implementation of precision MRI, molecular imaging, robotics for biopsy and treatment, and other precision diagnostics and therapeutics that transformed prostate cancer care. In 2005, we initiated a large-scale national public awareness campaign, Where is Manogram? Prostate Imaging for Men. In 2009, we had the first annual Prostate Cancer Awareness Day in Massachusetts State House and proceeded to create a new model in public education. In 2011, as the result of our advocacy, Massachusetts legislature had set up a historic precedent by recognizing prostate cancer as the central healthcare problem in men, a leading health disparity and public health priority. In 2013, Massachusetts legislature established a prostate cancer program. It started as a research project that was seminal in making MRI a new standard in patient care for guiding biopsies and treatment. So in 2014, we expanded our efforts in public awareness, reaching countless people. In 2016, we established annual global summit on precision diagnosis and treatment of prostate cancer, which, unlike other medical educational events, brought together leaders of all medical subspecialties involved in patient care, took down interdisciplinary silos and became instrumental in creating a broad international consensus on the best clinical practices and research priorities. In 2021, we had launched Prostate Cancer Equity Resource Project to make sure that all Massachusetts men had access to the best care available today. And in 2023, we created an international working group in minimally invasive treatment to expedite clinical testing and implementation of male lumpectomy. Our statewide program in prostate cancer created a Massachusetts model of national and global leadership in public awareness, medical education, research, and health equity. AdMeTech is leading prostate cancer program in cooperation with multiple organizations, including American Cancer Society, leading state clinical experts, and multiple branches of the NAACP and Latino health insurance program located across the state. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. Our public awareness has focused on the importance of screening and early detection, critical for saving lives. Since 2019, we reached well over 71,000 people. The centerpiece of AdMeTech's medical education is annual global summit on precision diagnosis and treatment of prostate cancer. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical field to review the best emerging clinical practices and research needs and priorities. There is not a corner of the world that has not been represented at this event. The latest 9th annual conference took place only in September 2025, several weeks ago. Our summit demonstrated that early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread outside of the prostate to other organs, only 28% of men remain alive at the same time. Early detection is particularly important for high-risk individuals, including any man with family history of prostate cancer or Black men who are twice as likely to die as white men. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. It is important for men to take charge of prostate health. To do that, it's important to know your risk factors, such as Black heritage, family history of prostate cancer, particularly when your brother or father had this disease, and increasing age, 50 and older. You can assure early detection during annual visit. Ask your doctor to discuss if PSA blood test and digital rectal exam are right for you. You need to talk to your doctor starting at the age of 40 if you have risk factors I just described, or at the age of 45 if you do not have these risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for at least 2 days. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care for all. More recently, experts from Beth Israel Lahey joined us. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older is welcome to participate. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the prostate cancer equity program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer longer term, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care, reflecting how doctors involved in this program would like to take care of our families and friends. This process consists of several components. First, AdMeTech Foundation's team collects basic information and match individual patients' needs with the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, financial and insurance assistance if needed. Third, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as, for example, additional testing or treatment. I'd like to provide a few recent examples of how PCE Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. David Einstein at Beth Israel Lahey, who agreed to provide a second opinion. In February 2025, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the original clinical care team to ensure a coordinated approach. In March 2025, this man and his wife described that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard immediate past president of Brockton and ACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. We got concerned, and after the meeting contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted us and we suggested for him to consult with Dr. Kwok-Ding Trink of Mass General Brigham, who can ensure the best of last care, including high-quality MRI. George has been so happy with his care that he became an advocate for our prostate cancer equity resource. In late 2024, Dr. Trink moved to Pennsylvania due to academic promotion. In March 2025, per George's request, we referred him to Dr. Adam Feldman, another leading clinical expert at Mass General Brigham and our partner at that clinical institution. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. We serve as your individual patient care advocates. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices in patient care that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.